The cough, runny nose, headache, wheezing, fever. Sound familiar?
Sure does.
While many may write it off as a typical cold, these symptoms could also be the signs of a common and highly contagious respiratory virus that has become increasingly prominent this winter across the country.
Here is Dr. Iris Gorfinkel, who joins us this morning to shed some light on this troubling illness. Dr. Gorfinkel, good morning to you. And these symptoms, yes, that Kara just mentioned, they sound like the common cold, but they're anything but.
It's respiratory syncytial virus, and it is a cause of the common cold, but it's also a cause of serious infections. So what are we talking about? Just as you mentioned, runny nose, sore throat, fever, but the problem is in people who are high risk, as in older people, infants, and the immune compromised. That's an infection that can travel down to the lungs and cause wheezing and pneumonia and severe illness.
And parents are familiar because, as you said, babies can get this, and it can be very disconcerting when you hear your baby suffering from this, and it sounds like it's hard for them to breathe. But it's also, but as you mentioned, it's concerning for the babies, but also for adults.
Absolutely. So older adults are especially at risk because of that disturbing problem called immune senescence. So as we get older, we're less capable of fighting these infections. So older people, especially people who have high blood pressure, who are overweight, over the age of 60 that starts to happen, where our immune system is just not quite as robust. So it's important to think about protection.
All right. Also important to think about protection because let's examine the raw data here because it is telling us that RSV is actually on the rise. It's higher rates compared to years past. Do we know why that is? You know,
it may be that it's more common, but it also could be that RSV is more readily diagnosed. We have rapid tests to do it. People are more aware of it. And there's testing happening on a hospital level as well as a community level. But that said, we are talking about a common virus. Common.
So how do you know if you actually have it?
There is no way. The best clinician cannot tell the difference between RSV, influenza, and COVID-19. So unfortunately, unless we have testing, we're not going to be able to know. So we have to think in terms of prevention.
Okay, well, let's break that down a little bit. When we talk of prevention, is there something we can do when it comes to RSV?
Like any virus, we're talking hand washing, we're talking about wearing masks, ensuring that when you're sick, you stay at home. And that's a big problem now. People think, oh, COVID's over, I don't have to worry about that. But actually, for the sake of the spread of all viruses, including the flu, we have to think about that. Stay at home when you're sick. Vaccination is a tentpole in remaining well. So that goes for influenza, that goes for RSV. We have highly effective vaccines that can keep people out of hospital that are long-lasting. We're talking about one and done because the data show at least 3 years of good infection at this point, good protection at this point. So we want to make sure people talk to their doctors about getting vaccinated.
How old do you have to be for the vaccine?
60 or pregnant people can also get vaccinated.
Okay. All right. Important
and infants.
And okay, so hold on. So who can get it?
So 3 groups.
Yes.
Well, 4 groups if you include immunocompromised, people 60 and over, infants can get that, and the vaccine can also be given to women who are pregnant, to pregnant people.
Okay. All right. Thank you, Iris.
Many thanks.
Very important.
This portion of the morning show is brought to you by GSK.